All right, Dr. Trevor Cabrera, the nomadic physician. What's up? What's good? Welcome to Docs Outside the Box. How you doing?
Good. How are you?
Good,
Nice
good. Where
to
you
be
located
here.
at, man?
Currently, I'm in Augusta, Maine, Central Maine.
Central Maine. So when I think of Augusta, I think about Georgia. But okay, so there is an Augusta in Maine.
hmm
It looks like, for those who are watching on YouTube, it looks like he's in an extended stay. It has that typical appearance of you got the hotel door with the exit right behind you, the exit mat behind you, and then you got microwave, refrigerator, and all the things that you need to do. A mini kitchenette,
Stovetop there. Yep.
stovetop, so you can cook if you're going to be there for an extended period of time. So you are a locums pediatric physician. And let's jump right into this. How long have you been doing locums now?
I'm actually a relative new grad, so I've been doing it since I finished residency 2020. And I mean, like immediately started straight into locums, did nothing else right out of training.
Okay, so
Uh,
all you know is locums coming out of fellowship or coming out of residency.
so kind of, not entirely actually. So I meant to do purely locums, but because of COVID, pediatrics took a huge hit. So unlike the rest of the world, seeing tons of people getting sick in medicine, kids stayed home. They didn't get sick as often. So the census for us went down. So actually, when I started working, I couldn't find work, consistent work for several months. I lived paycheck to paycheck. I lived like month to month waiting for locum work. I thought about quitting.
Wait,
And that
quitting
was
what?
quitting locums. I thought about going
Okay,
to a permanent job because I
got
couldn't
you.
find work. So that was 2020 for me. It would be the end of October, and I didn't know if I was working November. But I would be sitting there just waiting for my recruiter to call me and be like, hey, there's a new job. And then fast forward to last summer, June 2021, I had an opportunity for there was a locum to perm kind of job. But instead of us working a locum and then converting to permanent, they actually decided before I even started, they wanted to sign a permanent contract. So I did work as a permanent provider at this hospital in middle of nowhere, New Mexico, where I was there for 15 days a month. But the contract was effectively set up like a locum contract, but I was actually an employee as a permanent provider of the hospital. So it was kind of like a quasi kind of mix of both. So it's been kind of interesting because I've gotten to see both sides of it. I mean, that was a W-2 job. That was a job with some benefits. I had to be forced with some of the administration stuff, but it wasn't true permanent job because they still paid for my hotel. They paid for my rental, some CME stuff. I kind of just worked that into the contract, I guess, but it was effectively, basically in my mind, just a locum.
Got you.
so,
Got
so
you. How
basically,
about this? Let's take a step back. 2 years ago, you were finishing up your residency.
yeah.
I'm sure the majority of the rest of your current residents were thinking about graduating and going into their respective jobs. I'm assuming most of them hospital employed. Talk to us about why you decided to do locums.
So most people that I actually know in pediatrics too, a lot of them, yeah, they went to clinic or some went to hospital, some went to fellowship. Some private, some academic, all those different parts of it. For me, actually, it was kind of a hard situation because I actually went back and forth on doing fellowship myself. And I actually was forced to make a tough decision because of the AAP. As of 2020, there was a new certification that the American Academy of Pediatrics is pushing, which is for PHM, Pediatric Hospital Medicine. So as of 2020, anybody that graduates is being forced or required to do PEDS hospital medicine fellowships. So what that kind of put me in the situation of
So
was
basically, what you're saying is, if you graduate from a pediatrics residency, if you want to do pediatric hospitalist, you have to be board certified in a fellowship.
that is what they're trying to create.
Got you.
Correct.
And that's what you want to be a pediatric hospitalist.
No, not necessarily. I wasn't sure because I like intensive care. So
Got you.
I
Okay.
didn't know which fellowship I wanted to do, but I knew that as of 2020, unlike my colleagues before me, I couldn't jump straight into hospital medicine because right now the fellowship's not required across the country, but in 15 years it might be. And so my thought was, well, I'll go take a year to do locums, and then I'll figure
Mm.
out, do I want to go back for pediatric ICU, neonatology? Do I want to go back for pediatric emergency medicine or pediatric hospital medicine?
So was this a conversation that you're having in your mind, or is this a conversation that you're having with your attendings, your fellow residents? Talk to us about that whole deliberations.
Mainly myself trying to figure out what like specialty within pediatrics I wanted to do.
Because this is third year now, like third year, like, so how did even locums get into your mind? Like, who told you about locums? Because that's the other thing, because I think a lot of times people struggle with these decisions, but they're just like, well, I didn't ever even heard about locums until this point.
Yeah.
Did that happen to you?
It did. And so, for us, as a pediatric resident, we train in huge academic centers. We're not in the rural places. And that's an important distinction because where I trained, there was no such thing as a locum. Right? I'd never heard of it. And my residency program was big. We had about 30 residents per class. So I would say out of 200, 150, 200 pediatricians I've met, 0 or 2 of them have done locums, at all. And one of them did it as a bridge to his permanent job. And the other one did it just for a short time in the past. So for me, it was second year of residency. A locum agency came to talk to us. It's actually, interestingly, an agency that I don't work with, but they came to talk to us and I heard about the idea. And when I heard about it, at first I wasn't sure. And then when I got towards third year, I kind of started talking to agencies a little bit more and was like, this is a short-term idea. And so I can figure out applying to fellowship. I'm only going to do it for a year. We'll see what happens. But then I didn't find enough work. And so I decided, well, I'm going to extend this. And it wasn't just for the fact.
But when you say work, what do you mean? What
I literally did not have work.
This is your third year, or is this when you graduated and you were working locums?
When I graduated. So the plan was graduate.
We're just trying to keep the timeline right for the listeners so they can clarify. So now you have graduated, and now you are working locums, and you're thinking, should I try to find a permanent gig versus continue locums?
No, I'm graduate July, and I can't find consistent locum work for 8 months.
Oh wow! So you're not working at all.
No, I am. So I'm, like I was saying, I'm living like month to month. So the one job that I had in Huntsville, Texas in July 2020, they didn't have their schedule until the end of each month. So I didn't know if I was getting any shifts.
That's what I'm saying. Dr. Trevor, man, you got to be clear with this. All right. So you were working at a spot. They would do their schedule on a month-to-month basis, but you don't know if you're going to be a part of that schedule until that month schedule comes out, like maybe a week before the next month, correct?
Right.
Or something?
So that's what I said.
Gotcha.
So that's what happened in 2020. Mm-hmm. And so that's why I said 2020 that happened. And I did that. And I lived month to month and thought about, well, shit, I can't find consistent work. Mm-hmm. They're running out of days. Do I need to consider stopping locums and taking a permanent job?
Gotcha.
I didn't want to take a permanent job. But then in 2021, the next year, I kept working at that same site. And then it still was so unstable that I decided to take that semi-permanent job in New Mexico to make sure I had some consistency while the locum market was starting to come back.
So what was it like when you were telling your fellow residents that, hey, I know you're going to be going to this clinic spot. I know you're going to be going to this academic spot. I'm good. I'm just going to be looking at locums. What was that conversation like?
Everybody in the world thought I was crazy. My mentor, who was one of the 2 pediatricians I told you that I had met that did locums, he did it for a short time before he became a full staff attending, right out of training also, but only for a very short time. He literally told me I wouldn't do that. I would recommend or he said, be careful. Don't jump around from place to place because it's going to look bad. They're going to say, why are you jumping from place to place? Why can't you hold a steady job? And that was one of the big things I was told. And a lot of people were just confused. They didn't quite know what it was. And they still don't entirely understand it because I do it to an extreme. I mean, I do it a little bit more extreme than, some people, if they're doing locums 1 week a month, I do more than that.
So when it was time to graduate, I'm sure when it's time to graduate and you are looking at the presentations and your fellow resident is going here, your resident is going there, and it probably says for you, Dr. Trevor Cabrera, locums, full-time locums or whatever. Yeah. What was that like?
I mean, it was hilarious. Everyone was confused. And we had a Zoom graduation because it was COVID, right? So you see everyone's name goes up and it was like a presentation. And the second part, just to throw this in there to give you a background of who I am, I kind of forgot I had graduation. So I was in my kitchen drunk cooking some mushroom risotto. And I'm sitting there on the Zoom just cooking risotto while everybody's
Y'all hear this, y'all? Y'all hear this? He forgot about his graduation.
Yeah, and so I'm sitting there drunk, just cooking some fancy-ass mushroom risotto. And so they're like all talking, right? And in the chat box on the side, everyone, like literally 200 people watching. They're like, Trevor, what are you cooking? And I'm standing there cutting mushrooms. Everyone else's head is just sitting there, right, watching. I'm cutting mushrooms. I'm cooking. I'm like, oh, I'm making mushroom risotto, and everything goes up on the board, and then it says Locum Tenens for me, and I definitely got flooded with a bunch of messages, not just from my peers I'd talked to, but everyone else is like, what is that? Like people didn't know because, like I said, it wasn't talked about. I mean, I heard about a second year residency, but I'd never met a locum.
So why didn't that scare you? Like, why didn't that, even to that point, you're like, man, am I really making the right decision? I mean, I could be wrong. You may have already had those thoughts. Like, well, were you at that point like, this is not going to work? I don't think it's going to work.
I was freaked out. I made the decision a couple months before graduating, and then I was freaked out when I made the decision in third year. I was freaked out at graduation, and I became more freaked out, every day when I couldn't find consistent work. So when I graduated, I don't think I even had a locum job set up. I was just hopeful and optimistic that it'd come back. And so I grinded every single day to like try to find work.
So what was that? So the next day after graduation, you have no job. You don't have any perspectives at this moment. Financially, were there any preparations that you made right before graduating? Like, did you save up any amount of money? Did you have an emergency fund? Talk to me about that.
Yeah, that's a really good question. So I did. I saved up for a couple of months, but the main thing that I tried to save up on was to make sure that I had enough to pay my loans back when the federal loan, since you finish residency, when they start requiring payments to come back. The big thing that saved me was COVID in some ways. I mean, it hurt because I didn't have work, but on the flip side, the federal government froze my loans.
Gotcha.
So I was lucky to skate by. I also did things like extreme couponing. Like, man, I would. That's what
I want to know about your lifestyle. So let's talk about how you were able to pay for food. Like, did you save for food, couponing, rent, all that stuff? Like, so you had to save for all that, right?
Yeah. I think, no offense to most.
And where did you live? Where were you living?
So I still lived in my apartment in Houston.
H-Town, okay.
Yeah, so that's where my residency was. So I lived in my apartment in Houston, the same apartment, third year through graduation. And what I did was, the way I thought about it was, I saved enough money to pay rent, and I set aside money for food for a couple months before I graduated. And then each month I kept kind of reassessing that to make sure that I had enough. And the nice thing is locums pay well enough compared to a resident salary that me working, if I got a good week, 7 days of work in a month, I wasn't going to make money, but I could survive till the next month.
Gotcha.
So, and that's so sorry. So go to back up. So I'm not out of order here. The plan before I graduated, I did save up a safety fund. And this was really because I couldn't find work. And then when I graduated, I kept every month I had to reassess, am I at the right point for the safety fund? Do I need to consider stopping locums because my safety fund is going down? And that's where that mentality came in. So
went from graduation to when you first started your first locums gig, how long? Because I'm assuming you graduated sometime in June. July 1st, you ain't got no job. When did you start working locums?
I got offered one shift, July 27th, 2020.
One shift?
The locum job was for 1 day of coverage to go up for 24 hours to cover deliveries. I went up, I covered 24 hours, I did orientation.
Where's this at? Where's the first gig at?
Huntsville, Texas.
Huntsville, Texas. Gotcha.
Yeah. So, and the nice thing was it was within driving. So about an hour north of
So 3 weeks. So you had a job within 3 weeks of graduating.
I had,
or at least an opportunity.
I had 1 day of work.
That's good. I'm glad you clarified that.
I had
within 3 weeks.
Of work.
Got you. Okay.
And so I had 1 day of work. I went up there, sat in the hotel, didn't get called in. I was so confused. I was like a new attending, thought I was going to be seeing patients. But instead, I was sitting there at the hotel on call. I went up there for one shift. I went back home. I called my mom. I'm like, oh my God, they paid me to do this.
Well, hold on. Because you didn't get your money yet when you worked there, right? So, so when they gave you that July shift, you didn't know if anything was going to turn around for August, right? You didn't know anything about August. You ain't know nothing about September. Okay, perfect. So when you got there, so your recruiter tells you, hey, I found something for you. It's for one shift. It's in July. I'm interested. What was that first day like? Take us through what it was like. Take us through those conversations you were having with your mama, all that stuff.
So, the first thing I'll say is when I heard from my recruiter, I was like, oh, shit, good. I mean, I'd talked to probably a handful of agencies, and the first job was with Comp Health. And when they called me about this job, I thought a little differently. I thought a little bit more aggressively as a new grad. The first way I thought about it was, hey, I've got all this different competition from people that are experienced providers. And I straight up told my recruiter, I'm like, look, lowball them. I'll go in lower than my competition because I need work. And so I did. I went in low. I got one shift. I drove up there. I, was really nervous because I'm a new attending. I just started a new job, and I get all ready for orientation. I go in the next day. I walk into the unit.
And real quick, before you did that, how do you remember? You don't have to tell me how much you got paid, but do you remember how you got paid? Was it you got paid like every hour for 24 hours, or did you get paid for, you work for several hours and then you get to go home? Like, how did that pay thing work so people can get an understanding of how you got paid?
Sure. So there's different schedules and different ways that we get paid because our jobs are always different, whether we're clinic or inpatient or just on call. Mm-hmm. This job was something we were considered to be just on call. So I had a set amount to be on call for 24 hours. And then every hour that I
got paid a certain amount. There's a certain dollar amount to be available for 24 hours.
Certain base amount to be available for 24 hours.
Correct.
But then within that, at this particular job, it included within it 4 hours of work. Okay. So if I worked 0 hours or if I worked 4 hours, I got the same rate. But then every hour after that, if I had to work 5 hours, then I get 1 hour of overtime, which is an hourly rate on top of that.
Got you. So let's say you were getting paid $100 for 24 hours. Now, everyone listening, that's really low. I'm just using that for illustrative purposes. If you got $100 for 24 hours, that means that for hour 0 to the end of the 4 hours, you're going to get $100, right? And then if you were in your hospital, or excuse me, if you were in your hotel, and you stayed there for the rest of the, 18 hours, you're still going to get a total of $100. But if after 4 hours you were in the hospital for hour 5, hour 6, hour 7, hour 8, you would get additional pay, overtime pay, past that $100, correct?
Yeah, that's correct. So okay. That's basically, but most of these small jobs, the way they're set up like that, it sounds good in your head. You're like, all right, if I'm there for 8 hours, well, shoot, I'm going to be making this hourly. But this hospital is so slow that I never hit 4 hours, almost correct. Ever. So I took a low salary, and then I go up there for the first shift. And, I did it so that I wanted to do that so that they would confirm me. I wanted them to take me and I wanted to get my foot in the door. And that's where I thought very business strategy. I'm like, I could ask for all this money that all the other doctors are asking for. I'm aware of my worth, even though I'm a new grad, but let's try to get an actual job. I need food on the table, which is crazy to say as a doctor, right? But so I get up there, I walk in, I meet everyone, and I'm like, all right, well, I'm real confused because I don't even know. In residency, there's no on-call jobs. You're seeing people the whole time. So I go introduce myself, and they're like, all right, we'll call you if we need you. And I leave the hospital, and I'm like, what? Really confused. So, I'm like, all right. So I drive around the town. I go sit in my hotel room. I'm just hanging out. I'm like, this is weird. What am I doing? And I remember that night when it got towards nighttime, I actually called the night shift crew to be like, hey, just wanted to let you know I'm here if you need anything. And they're like,
we know.
All right. Why? Yeah. They're like, why are you calling? And they're, this is an old town where they're used to the old school pediatricians that, they don't call them unless someone's like dying. Right. And you hear me like being so eager to be like, hey, I'm free, but I'm a new grad. I don't know what the hell I'm doing.
They know you're a new grad. Yep. They got it. They know.
I don't know how much they knew I was a new grad right away. Cause I didn't tell everyone the first day. Right. So I think they might have, but they didn't know right away. And so I go home the next day and that's it. That's July 28th. I go home.
Okay. So let me ask you a question then. So you go home the next day. How long did it take before you got your first paycheck?
Luckily, the nice thing I will say, and this is something that does differ with locum agencies, is the way they pay you. With working with Comp Health, the one thing I don't put any particular favoritism out to be fair, no bias, but with Comp Health, the thing I really, really like about the company and CHG Healthcare in general is they pay me the next week.
Okay, so you got paid the next week. So I'm going to be honest with you. So the first time I started working as a locums, it took me about a month and a half to start working. So I started working late August after I finished my fellowship in, June 30th or 31. I can't remember if June has 30 or 31 days. But I worked for 2 weeks and then I got a paycheck. And I'm not going to lie to you, when I got that paycheck was multiple fractions of what my parents got paid in a year, right? Which is something that I've never seen before, right? Like I was so used to a resident salary, which was reasonable. And then all of a sudden I worked 2 weeks and it's like, whoa, like I've made this significant amount of money. I've never seen this amount of money before. I was extremely happy. I was extremely humble. But also at the same time, I was kind of freaked out. I was like, yo, I don't know what to do with this money. Right. And so when you saw your paycheck, right, how did you feel when you first got your paycheck? Now, granted, it's one day, but how did you feel when you saw that paycheck?
I kind of felt like I didn't really deserve it for the work I did. But at the same time, I felt the same way of like, oh shit, I just made a quarter, 25% of my monthly salary as a resident in one day. But realistically, not to talk too much about the numbers, but to be totally honest,
we should talk about the numbers. It's okay.
Well, I mean,
all right.
it's kind of hard because with that first job, it's difficult because, like I said, I settled and it was COVID.
Right.
But realistically, when I look back at those numbers, the amount that I got paid for that particular job wasn't really more than if I'd taken a permanent job.
Sure.
Like I said, if I had taken a permanent job, I actually might have gotten paid more for that kind of work. But it came with all the other pros of locums, which is a whole other, a longer conversation, of course. So I did have those feelings. I did have those feelings as you did of like, oh my God, I can't believe that. And it was actually really interesting, but at the same time, I couldn't enjoy it or think about it as much because I was very, very aware of how inconsistent my work was. So even if I got a big paycheck,
you didn't really consider it your money. It was like, yo, this is survival money right here.
Exactly. I didn't consider any money my money, and I didn't for a very long time. It took months until I got to that point, because even when I got to a point where I was out of the hole and let's put it this way, I had an emergency fund at graduation, maybe for 2 months. And as I went on and that emergency fund grew, like very, very slowly, I was able to project out, okay, 4 months, 5 months, whatever. It wasn't enough though, because my goal, my plan was to entirely move out of my apartment. So I needed an emergency fund that would account for the fact that I didn't have a place to live. And so I needed to think much bigger. So for me, the money was never in the first, I would say the first year I did locums, I wasn't in the black the first year.
Okay. So you were playing catch up in your head, you thought.
And I don't even mean for loans. I mean, I was playing catch up to survive.
Got you. So how long did it take you before you felt like you were even keel, like you were, floating in water with finances? I'm not talking about loans. I'm just talking about just with money that's coming in as a locums. How long did it make you till you felt like I'm good?
So for me, it probably took about 8 months.
Okay.
But just because of the inconsistency of work.
Right.
I think
how long did it take you to find consistent locums work?
A year.
It took you a year?
Yeah.
Okay.
And that's why the timeline was July graduated, inconsistent locums, February 2021, saved up enough to get out of my apartment, but still inconsistent locums. March 2021, signed a locum / permanent per diem contract in New Mexico so that I could fall back on that.
When you were doing that per diem work, were you getting paid 1099 or a W-2?
So that's where I was introduced by a locum agency to the hospital, but then immediately they signed me as a permanent person. So I was W-2.
Got you. So now when you are working, right, because I looked at all of the states that you've been in several hospitals since, right? Right now you are listed as full-time locum. So that means that you are not W-2, you are 1099, correct?
Correct. Last year, about 75% of my work was W-2. And this year I am, I guess to be honest, this year I'm about 90% 1099. I did recently take up a new per diem job, but that per diem job I think has to pay me W-2.
So how do you feel about work in general now? Like, how do you feel about the skills that you've learned in this locums type of experience? Do you feel like, comparing yourself to how you are now compared to maybe how your how your fellow graduates, maybe in their clinic position, their employee position, How do you think you are in comparison to them? Like, do you think like you are behind them? Do you think you're above them? Talk to me about that.
So there's two things I guess go gravitate to. There's one, the physical skills of my job in medicine, and there's two, the business side. One of the reasons I chose to do locums was I felt that I had a lot of oversight and I had my hand held in residency. And
Mm.
frankly, it's different than 10 years ago. It's not resident run training anymore. There's a attending doctor in-house overnight in the hospital. I could ask for help. So I wanted to leave. I wanted to get trial by fire. I wanted to put myself in situations where I was out in the middle of nowhere to see if I could broaden those skills. Because when there's not help and
Or
not
just see how good
backup,
your skills are in general,
well,
right?
I doubted them, and I was like, and I still doubt them, but I was like, if I'm out there and no one else can help me, I'm gonna have to do this shit. Like, I don't have a choice.
Right.
And I'll give like just some brief examples of that. I mean, last summer, I helped in part of a to stabilize and resuscitate a 28-week, 1,200 gram baby in middle of central Maine with a small critical access hospital. And we kept that baby alive for 53 minutes until we could get a neonatal intensive care transport team to pick the baby up. And, fast forward this past couple months ago, I was in Santa Fe, New Mexico, responded to my first neonatal code. And it was only my second successful intubation as a attending, but I got it right away because there's no one else that could do it. And I needed to intubate this baby so that we could resuscitate them. And I went in and I remember full code was blown. They called it full code blue overhead. I go in, there's like 25 people in, and like I'm like, shit, I'm the pediatrician. I
Hmm.
just worked a 72-hour in a row in-house shift. It was a 72-hour job. I did get to leave the hospital for 3 days. I run in hour 70 and I'm like, I got woken up and I'm like, shit, I got to do this. And so I go up and I just intubate the baby. And I mean, when there's no one else there, it was that fire. And so it gave me that kind of encouragement. And at the same time, I mean, another experience I had was I had a baby that blew a pneumothorax. Which is, where for anyone listening, the lung is collapsed and the baby needed a chest tube. I'd never done one. Um, and so I was lucky that the transport team showed up on time to help me, but I got to learn with them on the job. The neonatal nurse practitioner was like, "Hey, yeah, I'll show you how to do a chest tube." And so we did it, and it was a cool experience. And part of me doing these things was my original goal over time, going like we said earlier, wanting to go back to fellowship. I wanted some more learning out of residency, and doing locums has put me in a situation where I have obtained that partially by choice and sometimes by force. And it's sometimes what I needed to push myself out of the hole.
Hmm.
In that regard, I don't know that I would say I'm definitely still inferior to a lot of my colleagues that went straight to fellowship, but I've been forced to become more of a leader. I've had to run codes and run, or not full codes, but I've had to run resuscitations and run things that at fellowship, if I were still in training, I could always have someone else behind me. So it's forced me to grow and mature in that way, but it's also made me more humble because I realized, shit, the more I meet people, the less I know, and the more I see variability, the more there is I need to learn.
Yeah,
So
and I think that's a really good point because I think that there's the academic, large, tertiary care experience, and then there's the experience that you have. And one of the points that I tell residents, and I think one of the things that I learned is it's always good to have a good mix of those type of experiences.
yes,
Because if you spend a significant period of your time at academic hospitals, tertiary care hospitals, you're going to get called from a pediatrician or you're going to get called from somebody who's at another hospital, and they're going to be requesting to either transfer or they're going to be requesting for consultation. And it's very important for you to understand what kind of capabilities they have at those rural, suburban, or just let's just say not as capable facilities as a tertiary care center. And it's very important to understand, what they're doing at these facilities, the great things that they're doing at these facilities, so that when you get a consultation, it's not a, what's the word I want to use? Not an adversarial type of conversation, but really like a collegial type of experience where you're saying, okay, great, thanks, tag, I got it. I'll take over. And then also, like you said, like the amount of growth that you have to undertake when you are at these facilities by yourself and you don't have all of the resources, you don't have, all of these different things that you have at tertiary care centers. It does make you rely on your clinical acumen that much better. Everything that they taught you from a textbook standpoint, everything that they taught you from a physical exam standpoint, like you really got to rely on that. And I can definitely speak to that as someone who immediately finished fellowship and then I was working in a rural area and then I did like some work in Ghana. It's just like, whoa, like I was prepared for this, but I really wasn't prepared for this. And you just feel like you can grow from that. So I appreciate you sharing that. Now, I want to ask you about loans. Let's talk about loans real quick. Let's pivot a little bit. Because I read one of your posts where you talked about 10 years with the PSLF program, right?
Yeah.
Versus, so that's a loan forgiveness program, y'all, federal loan forgiveness program, versus doing 3 years with locums. Now, for everybody listening, my man, Dr. Trevor, had what, $315,000 of student loan debt when you finished residency?
Yes, that's including all the interest that built up over time.
Okay. So what are you handling? What is your decision? Did you decide to do PSLF or did you pay it all off or are you paying a significant period off? How are you handling your student loans?
So that's a good question. I'm happy to talk about the numbers on this one because I think this is something that's important. So I do the same thing. I talk to all my residents, all my med students. I'm like, you need to think about these things. The public service loan forgiveness is designed for your loans to be forgiven after 10 years with the caveat that you're working in certain practice settings. You're working in rural healthcare. You're working in a nonprofit. You're working at the VA. But the differential in how much they're going to pay you for that job versus working in a private job is pretty decent. And then the differential between those private and those academic jobs and locums is very significant. So, let's say that as a general pediatrician, you're making X amount of money to work as an academic center. It's probably 20% more to work in private practice. And at this point, to give you a ballpark, I work a lot, but this year, if I keep up my same work, I'm on track to possibly make around 3 times my peers.
I think you said at one point you're making like what an orthopedic surgeon would make.
Yeah,
correct?
if I continue working at the same level that I have this year, then I will. I made more than almost all the pediatricians I know in the last 6 months. In 1 year, sorry. So in the last like five months is mid-June. So in the last 5 months, I've already surpassed a 1 year salary for everyone I know. So that's where if I continue at this velocity, what I'm looking at, and this goes back to the instability of locums, but if I keep the current work I'm doing, there's a potential in the remainder of 2023, or 2022, there's a potential that one of those months I'm going to make more in 1 month than I did an entire year of residency.
Okay, that makes sense.
And and it's hard to say that as a pediatrician, because, for you as a surgeon and a pediatrician, just so everyone knows, we get the same residency salary. When we are first year residents, generally for most programs, the post-grad year, the resident salary tends to be the same across the board, maybe a little bit of variation, but not astronomical. But then, so for me to be able to do that as a pediatrician is frankly unheard of. And so that's where I'm at with my loans now is like that, like I said, to kind of harp back again, those 8 months after training, I was in the hole. And then about 1 year after training, when I started to feel more comfortable, I started to put a little bit less. I had a good emergency fund, and then I started channeling everything towards my student loans. So there's 2 parts of that's made it really nice. I put a majority towards my loans just because of my lifestyle. I don't spend a whole lot personally. But the hidden bonus that people don't think about all the time, because I work exclusively locum tenens, I don't pay rent. I don't pay for a car. So I'm saving an additional probably 20 to 30 grand a year, probably 50 grand now with gas prices, just based on the fact that the locum agencies reimburse for airfare, hotel, and lodging.
Okay, so quick question.
Cars.
So you don't pay for rent. So people want to know. So you're completely nomadic then. So where does your mail go to? If you are applying for something major, let's say you got to get a credit card or someone wants to write to you, Dr. Cabrera, I miss you. Like, you're my pen pal, blah, blah, blah. Where's your address? Like, where are you getting your mail?
Yeah, that's a good question. So I have a P.O. box in Texas.
Okay.
And also I I file my taxes essentially at my friend's house in Texas. And I have everything besides that still in the name of Texas, my license, my disability insurance. And part of the big reason is Texas has no state income tax.
Got you.
So I'm from California, but I don't claim that as home because I am always worried that they would want an income tax on top of my work, even if it's in other states.
Got you. So you completely live nomadic. You live in hotel to hotel or extended stay to extended stay,
Yeah.
but your actual like mailing address for licensing purposes, healthcare purposes, all of these different things are in one place, which is in Texas, and that's where everything goes.
Right. And I just have people I really trust down there.
So just as a heads up for people listening, there's an app. There's multiple apps they call virtual mailboxes. One thing to consider is you have you apply for this service. It's really cheap. It's like $99 or like $100 a year, and you have your mail sent to this virtual place. They open up the mail. First of all, they'll scan your envelope. They'll send you a note and say, "Hey, this is what you got. Do you want us to open it, or do you want us to trash it, or do you want us to mail it to you?" And it's all through your phone. You can send it to them. And if you say, "Yeah, I want you to scan it," they'll scan it in and send it to you and you can read it. Right. Or if they trash it, they'll trash it for you, or they can literally not open it, put another stamp on it and send it to whatever address that you have or that you're at. So they call that virtual mailboxes. A lot of people do that with real estate. If they have like a real estate rental property, a lot of people do that with businesses. So just something as a heads up, Dr. Trevor, and all the people listening, like you can kind of now technology's kind of caught up to this nomadic lifestyle where you can keep up with these type of things. So I'm interested. So right now, with your loans, I saw that you were able to make a significant dent in your private loans. Is that correct?
Yeah. So I had like 115 in private loans, paid those off last year.
Okay, so you paid it off in a year, basically.
I paid it off in half a year because like I said, I don't consider real money coming in until June of 2021, probably.
Mm-hmm.
So I paid that off last year. And as of right now, I'm down to under six figures, a little under six figures.
Congratulations,
left.
man. Congratulations. So
thanks.
you've decided not to do PSLF. You decided to just pay off your loans
Right.
at your own pace.
So that's why going back to that, to give like total arbitrary numbers, if you're doing an academic center and they are paying you $100,000 a year, right? But you have to do work there for 10 years to pay off your loans at the minimum payments. That's one option. But if you're going to be making 300,000 to do locums and you're able to pay more aggressively, then, I think the question that comes down that people have to think about individually is how much money are you truly going to save if you have loan forgiveness in 10 years? Like that's the thing. For some people, if they have $1 million in loans, then doing the minimum payments for 10 years, they're going to save hundreds of thousands of dollars. But if you only have $20,000 in loans, doing the minimum payments for 10 years is like you're going to save like $1,000. Like what's the
Yeah, and I also think it's lifestyle is also related and where you want to be. Like, do you want to be at a certain type of hospital? Do you want to be in a certain type of location? What do you want to do with your life over the next 10 years? Do you want that attached to something? Or do you want to kind of be freely mobile? And that was what me and my wife kind of thought about too, was like, well, we don't know what's going to happen in the next 10 years, but I damn sure know that those 10 years, I don't want loans to be a major part of it. That's how we thought about it. And with that thought process, that's why we decided to go ham on our loans early so that we can get it out of the way. So whether we've decided to have kids, whether we decided to, travel or what have you, we at that point realized that, you know what, I just don't want loans, whatever thought process that may be, to be in mathematics. Now, that's not for everybody. Everybody looks at it differently. You can skin a cat multiple ways. We just let people know how we go and how it worked for us. But appreciate your honesty on that. So
it's true. So I was sitting at a bar the other night. I was listening to the people next to me, and they're definitely these women that were probably in their later 30s, early 40s, still talking about their loans and how it's the problem. I'm just like, that's not, and I'm just laughing to myself because I'm like, I'm not going to have that issue.
Right. Now let's ask you about this. So you think that probably projected, maybe realistically, the next 5 years you'll get your federal loans all taken care of?
No, projected in the next 5 months I'll be out of debt.
Damn. Okay, that's what I'm talking about. Good.
No, 100. And so that's the thing, right? So I'm saving by the fact that I don't have to think about the other utilities. So I guess to give a good perspective here, I only spend about 10% of my adjusted gross income on life. I mean, on we're talking food, we're talking vacation, We're talking my disability insurance, my health insurance, 10%. All of that goes into only 10% of the actual money that's coming in. So, I have to think about taxes, of course, but outside of that, I mean, that's a good majority versus a very small amount versus if I had a rent an apartment and places to live and all of that, I'd probably be spending more closer to 20-30% of my income to take care of my life. So I think that's where I'm able to shift so much of everything. Of every dollar I make, I can shift closer to 70% of that straight to loans, or 50%, I guess,
Okay.
straight to loans.
All right. Let's talk about lifestyle.
Yeah.
Okay. So you work. You're working pretty hard. You're saying, who's making your schedule? You, or is it the hospital is making your schedule? Who makes your schedule?
Come on, that's why we do locums. I do whatever the hell I want.
Okay.
And that's what I tell everybody I talk to. So there's pros and cons for how I tell people this, but the way I set it up is I try to set up, and it's changed over a couple of years of doing this. I set it up so that I work like blocks of time in certain places, and we're not flip flopping super frequently. Currently, my job, for example, in Maine, I'm here for roughly about 3 weeks. At this particular job, I've talked to the director, and she's super nice and super cool with giving me days off in between these like stints of work. So today I'm off, for example. Some jobs I will intentionally work that 8 or 9 days in a row, and then I'll just schedule off a couple days afterwards. And I'll make that schedule, and I'll account for traveling myself, like my travel days, and I'll make sure to tailgate every job with the day off and a travel day.
Okay, go ahead, please go ahead.
Oh, I was going to say, so at the most extreme, and I try to be more, over time, since I've become less reliant on the need for money to survive. But over time, I've gotten a little bit more relaxed. But last year, it was a point where, man, I finished work at 7 a.m. in Central Maine and started on Monday, and then started 7 a.m. on Tuesday in New Mexico. And I
Bro.
was working like real hard, but
So,
now it's like I'll schedule in days off.
okay, so what's the longest break you ever took working out of residency? Like once you started working locums now consistently, what's the longest break you've ever taken?
Yeah, longest intentional break after I started having consistent work. Oof. I mean, I think it was this past month. I took like 5 days off.
Bro. All right, so then that leads to my next question. Do
Yeah.
you think that you're working too much? Right? Let's talk about resident life versus attending life. Because as a resident, there's duty hours, right? There's a certain amount of hours that you're going to work, and then that's it. When you're in attending, I'm sure you've realized, like you mentioned before, there's 72 hours straight, and you possibly may be working, but that's your schedule. You set it up that way. You don't necessarily have, you don't have to work that way at all. You chose to work that way. But I'm
Correct.
concerned, like, let's talk to the people about, do you think you're working too much right now versus how it could be?
For me personally, oh hell yeah. But part of why I set myself up for it was that in my head, um, since my view is pointed towards fellowship, I didn't want to lose too much of the mojo. So, I've realized when I have too many days off, I see it. Like I'm off today, I'm gonna go eat lobster, sit at the beach in Maine. That's what I'm gonna do, and it's nice, and I'm enjoying those days off that I didn't have in residency. But I try not to get too much towards that, only because I want to keep up the momentum to go back to training. So that's my personal thought on it right
So
now.
do you feel like, because in many respects, I think you're probably putting in more, you don't think it is, but you're probably putting in more hours as an attending than you are as a resident.
I am putting in more hours sometimes. So it depends on what the job is.
Hmm.
For example, last year I worked 26 consecutive days on call in Huntsville, Texas.
Hmm.
I went into the hospital for a total of maybe 5 or 6 hours.
Hmm.
So I was on call that time, and yeah, being on call mentally
That
was
counts.
different.
That counts, bro.
It counts, but at the same time, if you're able to if you're able to separate it and to be able to do things outside the hospital, being on call, it was a little bit different than being as a resident, I guess. Like I didn't have to physically be in the hospital, so it felt different. But I definitely am working more. But the difference, of course, and I've talked to people about this, is I get paid for it. So like,
Sure.
yeah, that's where it's not. It's something where I excuse it. And I actually, that part of that 72-hour job I told you about, it's part of a bigger picture. I worked 6 days in New Mexico which 120 hours were in the hospital.
Hmm.
So it's a lot, but I do it partially for the challenge too. Maybe I'm just, psychotic or something, but it's kind of fun. Yeah.
Okay. Well, for the folks, that are listening, one of the best things of what Dr. Trevor said is he makes his own schedule, and you can decide how many days in a row you want to work, or how many days a month you want to work. If you want to do like 10 in a row, 14 in a row, or however long in a row, you decide that. You make that choice up to you. And it's unlike residency where someone is keeping track of that and putting a hard stop on how long you're going to work. And I think that's one of the big things, I think, looking back in terms of residency and attending life, that I think we in residency do a poor job of, is preparing you for that difference in per hour, how many hours you're going to work as an attending. And I don't know what the answer is, but I definitely think that, if we do resident work hours, which work, but then we are putting them in a situation or in the outside world where there aren't any work hour limitations, there's a bit of a disconnect. And I don't know what the answer is, right? Like, it's you're preparing them for safety in one area, but then you're graduating them into a place where nobody's keeping track of their hours. And I can say as an attending, I put in more hours as an attending than I do than I did as a resident.
So
Go ahead, please.
I was going to say, especially as a surgeon.
Yeah.
Like, especially as a surgeon.
So I don't, to this day, I don't know what the answer is, right? I do think that the way how we're training residents is correct, but also at the same time, I don't know, just because we're training them correct doesn't mean that we're preparing them correct, if you know what I'm saying, right? Like,
right.
If you're putting them in a world where there's no resident work hours, then why are we training them with resident work hours? But you actually do need resident work hours because you don't want them tired. So it's weird. I don't know the answer to that, but that's just something to think about, and something that now that I'm 10 years out is very, very interesting. So overall, Dr. Cabrera, what kind of lifestyle do you want? Let's talk about it.
Yeah. So, I want to be financially not tied to loans. I think that's because that's obviously my big priority here. Now, I'll say one thing I forgot to mention on why I work so much is this: by working this many days, this is how I get the locum agencies to cover all of my housing, because normally they're only going to cover the day before. I love it.
Give me more. Come on.
So the strategy, right? The strategy is they're going to cover the day before, the day after the job assignment dates, and so. I think historically they used to cover more than that. I don't know. You could correct me if I'm wrong, but now I think people are a little bit more stingy on that. So if I'm working Monday through Sunday, they're going to cover the Sunday before until the Monday after.
Perfect.
The day before, day after. That goes for the rental. That goes for the hotel. And then the flights, I'm able to kind of schedule that differently. So to give you a real example right now, June 14th, last week, I took 4 days off. What I did was I used the locum agency to fly from California to Maine. And then on my own dime, I spent 3 days on vacation, but then I picked up another rental under the agency to come back into the hotel to work for my couple of weeks. And then when I leave, I'm going to fly out on the agency and go back to wherever I'm going. So there's that part of it. And that's why I schedule so close to close, back-to-back, piggyback jobs. And the big point to point out to that,
it's like you're travel hacking. That's what it is.
It is travel hacking. To talk about a little bit, to give people a little bit more of a number. And then we talked about it before, but I traveled 320 days last year. And this year it is June 14th, and I have traveled, I believe, something like 180, like 283.
So you're ahead of schedule.
Yeah. But that's how many days I've been traveling. Now the question is what kind of and I go back to what kind of lifestyle. So the unseen other benefits, right? My plan, if everything worked out, I would apply to fellowship right now. I would match into fellowship next year. And I go back and forth, so don't hold me to that, because I do love this lifestyle. But the plan is next year I'm planning to take off a whole month, and I'm going to travel probably Europe or somewhere else purely on all of the 2 million points that I've accumulated by living in hotels. Longer. So at this point, I
make it longer, Dr. Trevor.
Yeah, that's the thing.
Give yourself make it 2 months.
Huh?
Make it 2 months. Nobody's checking on you, bro.
No.
You deserve it.
No, I might do some things, but I'm saying that just the point being that with this lifestyle, what people don't remember, they think about all the time. And sometimes people ask me is the points. What I'll usually do is I have a card that's a Hilton Honors card, credit card. I'll pay for the hotel on the Hilton card. I'll get points for that. And then I'll get reimbursed from the agency. So I end up getting like triple, quadruple points on a hotel stay. And it puts me in a point now that I could literally go to Europe for probably, you're right, 2 months just purely on the points. So it'd be like a paid vacation other than the food.
Dr. Trevor, I think you should extend it out to 2 months. Don't just do it. It's okay. Like nobody is checking for you. There's nobody who's gonna check a box. Give yourself the time, the grace to take however time that you want off. So,
Yeah.
well, listen, this was a really dope conversation, and I think that I wanted to harken back to what the attending said, that if you go from job to job to job to job, that possibly could be, maybe a poor reflection on who you are as a pediatrician. And I can say that as 10 years out, I had that same conversation with attendings. And I'll leave it to you like this. Those same attendings have called me several times over the last, I'd say 3 years, asking, hey, what company did you go with?
Yeah.
Hey, how did you set yourself up with locums?
Yep.
Hey, I'm sick and tired of X, Y, and Z. Can you teach me how you're doing locums? Hey, blah, 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 blah. I think that a lot of people make comments, and I know your attending did locums, but I think, it really comes down to individually who you are. Are you going to be able to, like, what kind of panache are you going to bring when you come to a job, right? Because I think just saying that if you go to locums, you're going to have this dark shade on you. I think that that's the wrong perspective to give residents, right? I think there are multiple ways to skin a cat and there's multiple ways to practice. And I'm really glad that you heard all that information and you decided still to try this out, right? And now you're thriving in it now.
Yeah, and I want to just one more thing to say, add on to that. So I've loved it for a bunch of reasons. It's not for everyone.
Right.
Like you said, I do it to the extreme. You can do it, but the best part is you can do it how you want to. I've been learning so much. I've learned these contract negotiations. I've worked in a dozen hospitals in the time that all my friends have worked in maybe one job. There's just parts that go to it, but at the same point, something I've noticed with being dropped into places, man, in my head, and I maybe it's a grandiose idea, but in my head, we're like freaking special ops. And it's awesome.
Yeah.
And I can do stuff, and I can do things in some ways that like other people are like, how did you do that? I got an orientation at a hospital, at a quaternary care children's hospital, from 9 a.m. to 12 p.m. And I got thrown in just like helicopter, dropped in 8 p.m. Starting that night as the nocturnist. Like I can do that, right? I can learn an EMR in 2 hours. I can be flexible and adaptable. They call us in for jobs where they can't find people. They call us in for jobs that need someone that can be quick, that can learn fast. And if anything, I think it sets us up as more attractive candidates for the future. Because that's the thing. People ask me now for jobs. They're like, can you do this? I said, yes, or I can figure it out immediately. I don't need to go through your 2 weeks of orientation. You give me 30 minutes and I can hit the ground running anywhere.
Absolutely.
Just like falling out of a helicopter. So that's kind of like in my head, the way I think about it. So that's kind of where I've been. And that's why I love being it's the Nomadic Pediatrician. That's like
tell them where it's at. Tell them where it's at. How do they find it?
So if anyone's listening for that, my blog where I've got a lot of things on locums, my travels, and also I've got a brewery map and pictures of all the food I cook in these hotels, which is awesome. But it's the nomadicpediatrician.com. Try to just keep things, real and show people what your life can be like if you make the choice to live it.
Yeah, I get it. And I think we're going to leave it at that. It's the life that you want if you decide to live it, right? And I think that that's a huge change from residency, where you feel like you're just trying to survive and you feel like you are under the thumb of somebody else. And as a resident, as once you finish and you have an attending, you're at an attending level, whether you decide to do private practice or you're working on your own or you're doing locums, it's really, you make the decision as to what you're going to do. So, hey, I appreciate this talk. This was really dope, Dr. Trevor. And listen, I hope to hear from you next year when you're doing your 2 months off somewhere on a train in Spain or wherever you are in the Channel or something dope, and let us know how you're doing. All right.
Yeah, no, I appreciate it. Thank you so much, man.
All right, man. Take care.
All right. Have a good one.